did a QI project as part of the West Midlands Severe Asthma Network, where we asked 157 children and families, asking them to see how they can identify an empty inhaler. What we found was even those who were using the inhaler with a dose counter, 20% of them were still using it beyond the 200 doses, because when they pressed, they could still see some gas coming out, or when they shake, they could hear a click, both of them which are wrong. And what we also need to be mindful is the most commonly used inhaler, the blue inhaler, it does not contain a dose counter. And it's very important for us to think about how do we educate our families in terms of identifying when they have to change their inhalers. We also looked into the patient information leaflets which come with the commonly used inhalers. And to our surprise, they had very little information which are provided to the patients about identifying when their inhaler is empty. And more importantly, the inhaler technique pictures which are shown in this patient information leaflets, they do not contain spacers. So this is what commonly our patients will be seeing. So this really surprised us, and it shows that there is a lot of work which needs to be done in this area. The final thing is, we also asked the families, what do they do when they've used their inhalers? How do they dispose it? Most of them, more than 90% of them, they said they throw it into a bin, a black bin, because there are no recycling facilities which are available. The take-home message is always look at the inhaler, look at how many actuations they recommend on the box. And then if your inhaler has a dose counter, when it reads 0, please change to a new inhaler. Just by shaking, hearing a click or seeing some gas coming out when you press does not always mean that your inhaler has medicines in them. The second thing is, if your inhaler does not have a dose counter, then perhaps you may have to keep a tally count, so that once you have reached the recommended actuations, then you change to a new inhaler. The way forward with the meter dose inhalers is first of all, they need to be recycling facilities. There need to be a change in technology, and more crucially, the pharmaceutical industry and the regulators should work together in terms of providing better information to our patients through the information leaflets about how to identify when their inhaler is empty, and then perhaps make the dose counters mandatory in all the inhalers as part of essential asthma care, where we discuss inhaler technique, using the right spacer device, and providing them a written asthma plan. We should also include discussions around how to identify when their inhaler is empty. Thank you.